What if I told you that your doctor's proudest achievement, finally getting your blood pressure down to 120/80, might actually be putting your life at risk? If you're over 70 and your physician just celebrated hitting that textbook perfect number, you need to hear what a major study published in the Journal of the American Medical Association actually found. Researchers tracked 15,000 seniors for 5 years, and the results contradict nearly everything we've been told about blood pressure targets for older adults. The seniors with so-called perfect blood pressure had a 28% higher risk of serious falls, and their mortality rates were actually worse than those with moderately higher numbers. In the next few minutes, I'm going to walk you through the exact blood pressure range associated with the longest survival in older adults, explain why the standard target may be dangerous after age 75, and teach you one simple test you can do at home tonight that could prevent a devastating fall. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Drop your age in the comments right now, just your age, nothing else. I want to see who's watching because the information I'm about to share applies differently depending on whether you're 65, 75, or 85. And if you've ever felt dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. This is critical information and you'll understand exactly why in just a few minutes. Here's what's happening in doctors' offices across the country every single day. A 78-year-old comes in for a routine checkup. Blood pressure reads 145/86. The doctor pulls up the standard guidelines, sees the target of less than 130 systolic, and immediately reaches for the prescription pad. One medication gets added, then another. Over the next 6 months, that blood pressure comes down beautifully. 124/78. The doctor is pleased. The patient gets a gold star on their chart. Everyone thinks this is a success story, but here's what those guidelines don't account for. That same 78-year-old stands up to go to the bathroom in the middle of the night, and their blood pressure drops from 124/78 down to 88/56 within seconds. Their brain isn't getting enough blood flow. The room spins. They reach for the wall and miss. And suddenly, we're not talking about blood pressure numbers anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in a rehabilitation facility, and a cascade of complications that too often ends in a loss of independence. Or worse. Research published in JAMA Internal Medicine should have made headlines everywhere. But most doctors still haven't seen it. And the gap between what the research shows and what's happening in everyday medical practice is costing lives. Here's the part that's going to sound counterintuitive. Stay with me because this is where everything changes. For decades, the message has been simple. Lower blood pressure equals better health outcomes. And for middle-aged adults, people in their 40s and 50s, that's largely true. Getting blood pressure under control in midlife genuinely prevents heart attacks, strokes, and kidney disease down the road. The evidence on that is solid. But something fundamental changes after age 75. Research shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. The group that achieved that textbook perfect 120/80 had higher rates of dizziness, syncope, that's the medical term for fainting, acute kidney injury, and yes, higher overall mortality rates. If you value understanding the why behind the numbers rather than just being told what to do, what I'm about to explain will give you a completely different framework for thinking about blood pressure management as you age. Your cardiovascular system at 75 is not simply an older version of what it was at 45. It is fundamentally different in ways that change what blood pressure numbers actually mean for your health. There are 3 critical changes that happen with aging, and each one demands a different approach to blood pressure targets. The first is arterial stiffness. As you age, your arteries become less elastic. Think of a brand new garden hose compared to one that's been sitting out in the sun for 20 years. The old hose is stiffer, less flexible. Your arteries undergo a similar process called arteriosclerosis. When your heart pumps blood into stiff arteries, they can't expand and absorb the pressure wave the way young, flexible arteries can. This means you need a slightly higher baseline pressure to ensure adequate blood flow reaches your brain and kidneys, especially when you're standing upright and blood has to travel against gravity. The second change is that baroreceptor function declines. Baroreceptors are tiny sensors in your blood vessels that detect pressure changes and instantly signal your brain to respond. When a young person stands up, their baroreceptors detect the pressure drop within milliseconds and trigger compensatory responses. Heart rate increases, blood vessels constrict, pressure stabilizes. But these baroreceptors become less sensitive with age. They respond more slowly. So if your baseline blood pressure is already low and your baroreceptors are sluggish, you get that dangerous drop in pressure when you stand, what's called orthostatic hypotension. The third change involves how medications are metabolized. Your kidneys and liver don't clear medications as efficiently at 75 as they did at 45. A dose of blood pressure medication that's perfectly appropriate for a middle-aged person can be excessive for an older adult. The medication lingers in your system longer, has stronger effects, and can push blood pressure dangerously low. Now let me give you the exact details of the research because the specifics matter. The study published in JAMA Internal Medicine followed 15,342 adults over the age of 75 for an average of 5 years. These weren't hand-picked, unusually healthy seniors. These were real-world older adults, including those with diabetes, prior strokes, heart disease, and varying levels of frailty. Researchers tracked their average blood pressure and monitored outcomes over those 5 years. Participants were divided into groups based on systolic blood pressure, below 120, between 120 and 130, between 130 and 140, between 140 and 150, and above 150. Here's what they found. The lowest mortality rate was in the group with systolic pressure between 130 and 140. Not below 120, not the textbook perfect number, the moderate range. Those with pressure below 120 had a 28% increased risk of serious falls, requiring hospitalization, higher rates of acute kidney injury, and an overall mortality rate 14% higher than those in the 130 to 140 range. The group with pressure above 150 also had problems, as you'd expect, higher stroke rates and more cardiovascular events. But the surprising finding was that very low pressure was just as dangerous as very high pressure. The sweet spot, the range associated with the longest survival and best quality of life, was higher than conventional guidelines recommend. Let me walk you through a scenario that plays out thousands of times every day in this country. You're 76 years old. You go in for a routine checkup. Blood pressure reads 142/84. Your doctor looks concerned, references the guidelines, and says you need to get this down, ideally closer to 120. You're started on a medication. 2 months later, your pressure is 128/78. Your doctor is pleased but suggests adding a second medication. 2 more months pass. Your pressure is now 122/76. Perfect. At first you feel fine, but then you start noticing something. When you get up from your chair to answer the phone, you feel momentarily lightheaded. When you stand up from the dinner table, there's a split second where the room seems to tilt. You mention this to your doctor, who says it's probably just age-related, your blood vessels adjusting more slowly, and tells you to stand up gradually. But what's actually happening is that your blood pressure, which looks great sitting still in the office, is dropping dramatically when you stand. From 122/76 sitting down to perhaps 95/60 standing. Your brain is experiencing repeated episodes of inadequate blood flow. You are at high risk for a fall, but nobody is checking for it because your sitting blood pressure looks textbook perfect. This scenario is preventable. If we understand that blood pressure targets need to be individualized based on age and functional status, not applied universally. There is a simple test that takes about 3 minutes and can identify whether your blood pressure medications are putting you at risk for a fall. It's called orthostatic vital sign measurement, and most doctors aren't doing it routinely. Here's how to do it at home tonight. You need a home blood pressure monitor. They're available at any pharmacy for around $30. Lie down flat on your bed or couch for 5 minutes and rest. After 5 minutes, check your blood pressure while still lying down. Write down both numbers. Now stand up and immediately check your blood pressure again while standing. Don't wait. Write down those numbers. Now compare them. If your systolic blood pressure dropped by more than 20 points, or if your diastolic dropped by more than 10 points, you have orthostatic hypotension. This is a red flag. This means your medications may be too strong or your target blood pressure may simply be too low for your physiology. To make it concrete, imagine your lying blood pressure is 125/78. Looks great on paper, but when you stand up, it drops to 98/64. That's a 27-point systolic drop. That's dangerous. Your brain is getting inadequate blood flow when you're upright, which is most of your waking hours. You might feel fine lying down or sitting, but when you're vertical, you are operating on insufficient pressure. This is the test your doctor should be performing at every visit if you're over 70 and on blood pressure medications. If they're not doing it, you can do it yourself and bring the results to your next appointment. So what should your blood pressure actually be? Here are the ranges that research associates with the best outcomes for different age groups. Keep in mind, these are guidelines, not absolute rules. Your individual target should always be determined in collaboration with your doctor based on your complete medical picture. For adults aged 65 to 74 who are generally healthy and active with no major medical conditions, research suggests a systolic range of 130 to 140 is reasonable. This provides cardiovascular protection while maintaining adequate perfusion to organs. For adults aged 75 to 84 who are relatively healthy, the evidence supports a systolic range of 135 to 145. This is higher than the younger group and deliberately so. It accounts for increased arterial stiffness and slower baroreceptor responses. For adults over 85 or for those who are frail, regardless of age, a systolic range of 140 to 150 may be most appropriate. At this stage, preventing falls and preserving quality of life often takes priority over aggressive blood pressure lowering. As for diastolic, the bottom number, for older adults it should generally stay above 65, ideally between 70 and 85. Very low diastolic pressure reduces blood flow to the heart muscle during its relaxation phase and can cause serious problems. If your diastolic is consistently below 60, that warrants a conversation with your doctor even if your systolic appears normal. And here's what most people don't realize about blood pressure throughout the day. One reading of 148/86 doesn't mean your pressure is always that high. It might be 132/78 in the morning and 145/84 in the evening. What matters is the average over time. That's precisely why home blood pressure monitoring is so valuable. It gives you a far more accurate picture of your true average than occasional office readings ever can. You may be wondering why, if this research exists, your doctor hasn't mentioned it. The answer is complicated. Most blood pressure guidelines were built on large clinical trials conducted primarily in middle-aged adults. When those results came out, the guidelines were applied broadly across all age groups, under the assumption that what's good for a 50-year-old must also be good for an 80-year-old. Over the past decade, researchers have started looking specifically at older populations and finding that one size absolutely does not fit all. The problem is that it takes years for new research to filter into clinical guidelines and even longer for those guidelines to change clinical practice. Many physicians are still operating on guidelines published 5 to 10 years ago. There's also a psychological component. For decades, doctors have been trained that lowering blood pressure saves lives. Shifting from that ingrained message to a more nuanced approach takes time, critical thinking, and the kind of individualized attention that a 15-minute appointment rarely allows. Let me give you specific, concrete action steps you can begin tonight. First, if you're over 70 and on blood pressure medications, purchase a home blood pressure monitor if you don't already have one. Check your pressure at the same time each day, morning and evenings for 2 weeks. Keep a written log. This gives you an accurate average and helps you identify patterns. Second, perform the orthostatic blood pressure test described above. If you find a drop of more than 20 points systolic or 10 points diastolic, document it to discuss with your doctor. Third, assess your symptoms honestly. Are you experiencing dizziness when you stand? Unexplained fatigue? Difficulty concentrating? These can all be signs that your blood pressure is running too low, even when the numbers in the office look fine. Fourth, schedule a dedicated appointment with your doctor to specifically discuss your blood pressure targets. Don't accept a blanket statement that you need to be at 120/80. Ask what target is appropriate given your age, your other conditions, and your functional status. Bring your home monitoring log. Bring your orthostatic measurements. Have an informed conversation. Fifth, if you are experiencing side effects from blood pressure medications, speak up. Many people assume that dizziness or fatigue on medication is simply something they have to live with. It often isn't. Doses can be adjusted, medications can be changed, and targets can be modified to improve quality of life while still providing real cardiovascular protection. Here's what you now know that most people, including many healthcare providers, don't fully appreciate. Blood pressure targets should not be universal. A 45-year-old and an 85-year-old should not be held to the same standard. For older adults, especially those over 75, systolic blood pressure in the range of 130 to 145 is associated with the longest survival and the best quality of life. Lower than 120 increases the risk of falls, orthostatic hypotension, kidney injury, and possibly cognitive decline. Higher than 150 increases cardiovascular risk. The sweet spot is in the middle. You've learned that orthostatic hypotension, that dangerous drop in blood pressure when you stand, is often more harmful than moderately elevated sitting pressure. You've learned how to test for it yourself at home. You've learned the physiological reasons why seniors need different targets: arterial stiffness, slower baroreceptor responses, and altered medication metabolism. Most importantly, you now have the language and the knowledge to have an informed conversation with your doctor. You are not just a passive recipient of medical advice. You are an informed participant in your own care, and that is genuinely empowering. If this information gave you clarity, drop the word informed in the comments right now. If it helped you feel more equipped to advocate for yourself, share this with a friend or family member over 65 who needs to hear it. In the next video, I'll be covering the 3 supplements that research actually supports for healthy blood pressure and the 2 popular ones that are a complete waste of money. The supplement industry is full of misleading claims, and I'm going to show you exactly what the evidence says. You'll want to see that one. This video is for educational and informational purposes only and is not intended as medical advice. Blood pressure management should be individualized based on your complete medical history, current health status, and other factors. Never adjust or discontinue medications without consulting your healthcare provider. Always consult with a qualified healthcare professional before making any changes to your treatment. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this.
Thank you for watching, and here's to living life on your own terms.